Good afternoon, everyone, and thank you for joining us. This is Abby Schonecker, Marketing Specialist at Spok, and I'll be moderating today's webinar. Today, we'll be talking about the 5 dangers of not having call recording in your contact center. Tom Goodwin, Vice President of Marketing at HigherGround, and Mark Davis, Senior Product Manager at Spok, will share what can go wrong when you don't have a call recording solution, as well as best practices for call recording in healthcare. Before we get started, I'd like to go over a few housekeeping items. Everyone will be muted during today's webinar, but we welcome your participation. Please submit your questions via the questions box in the GoToWebinar toolbar, and then Tom and Mark will answer as many questions as time allows after the presentation. A recording of this webinar and the presentation slides will be sent to all registrants tomorrow, so please feel free to share these with others at your organization. At the end of the webinar, you'll have the opportunity to complete an evaluation. We'd love it if you could take a couple of minutes to complete this survey. Your feedback helps our efforts to provide you with relevant and informative presentations. And with that, I'd like to turn it over to Mark, who will begin our presentation.
Thank you, Abby, and thank you, everybody, for joining our call today. I wanted to briefly go over our agenda with you. Today, we're going to be talking about our backgrounds and how long we've been in partnership together, as well as I'll be addressing specifically the 5 dangers of not having call recording in your contact center. Tom will also touch on best practices for call recording in healthcare, and we'll have some additional information to share with you as well as our conversation continues. So a little bit about HigherGround and Spok. We've had a partnership since 2005. HigherGround has over 40 years of experience. Spok, as you know, most of you may be aware, started off in the early 80s. And together what we saw was a need to bring our solutions together to provide for our customers a well-rounded solution. The combined power of Spok's Care Connect and HigherGround and their Calibre solution illustrates how this solution is equipped for healthcare providers with a highly reliable centralized system that allows physicians and others to reach the right person 24/7. The result of this is increased quality of patient care and decreased costs from poor communication and loss of information. For modern hospitals, call recording should be prioritized as a must-have. Call recording in your healthcare contact center provides agents with the tools they need to deliver top-notch customer service every time they're on the phone. It also helps advance regulatory compliance, elevates hospitals' reputations, and much, much more. Let's examine the 5 dangers of not having call recording in your contact center. The first of which is violating regulatory policies. Unhappy patients, unproductive agents, misunderstanding the voice of the customer, along with poor liability management. It is essential to record and store all telecommunications interactions, primarily for accuracy and reporting, as well as HIPAA audits. Compliancy with medical records regulations is a complex process, as we all know, and is continually under investigation. Having recorded interactions and reports can assist in showing your compliance. Hospital contact centers are bound by the same regulatory laws as the patient's floors. They also have to adhere to HIPAA and other patient privacy rules and regulations. Recording and storing all telecommunication interactions ensures you're ready if your organization undergoes a HIPAA audit. Recordings can also assist in showing compliance with medical record regulations. In the era of consumerism, and I know those of you that are familiar with the advisory board, we're hearing a lot about this lately, and what this is really the merger of technology and the retail experience in other aspects of how we do business today, and in all aspects of how we do business today. Most hospitals know that they have to keep patients satisfied to remain their care providers of choice. And this is a big issue. And think about this, especially when we come down to Yelp reviews. Calling in to schedule an appointment or check in on a loved one should be a hassle-free process that gives them the information they need and leaves a positive impression. Makes sense. Should be the way it goes. This is what's interesting. Call recording can help ensure that your hospital patients are receiving top-notch customer service every time. Contact center supervisors can use recordings to produce examples of expertly and poorly handled calls to ensure performance grading and help educate agents on how to handle certain scenarios. Call recording helps provide proper training to improve interactions with patients. When you don't know what you don't know, how can you improve? You risk having unproductive agents in your contact center if they are not empowered to play back their conversations and learn from them. So in the contact center, without call recording, the agents do have the ability to learn from each other, and they can coach each other, which is great whether if your contact center is centralized or decentralized. But ultimately, if you have a way to let them listen to themselves and understand how they are delivering their communications, you can have a lot of improvement. And beyond this, you can also standardize across your entire organization, which of course improves, and increases operational efficiency. So call recording enables you to develop scripts from previous calls, so operators are prepared to efficiently address the most common requests. Call recording includes screen capture, or what we call quality management, in addition to audio. So these can also be reviewed for opportunities for improved efficiency. So oftentimes, as operators are interacting with the system and with systems outside of their main console, you have the ability to see what their workflows are, and there are opportunities for efficiencies and improvements in this. And I'll give you an example. If it takes an agent a long time to execute a particular task, your contact center could implement a shortcut key so they could accomplish it with I'd say, fewer keystrokes. I think that's a great example. Call recording allows you to better understand your customer needs. So why are they going to your hospital? Are there issues being resolved? Did they get the information and help that they were looking for? It also helps with reputation management. Find out why they are satisfied or dissatisfied. The contact center is perhaps the #1 underutilized resource for understanding your customers. With most large organizations fielding hundreds or thousands of calls per day, you are missing out on a treasure trove of data if you don't have call recording installed. Call recording can help you better understand your customer needs. Why are they going to your hospital? Are they getting the information and help they're seeking? Are they satisfied? Are they dissatisfied? Just why? In the event of a malpractice case or dispute resolution, call recording allows you to revisit the communication in question. Communication issues are often at the core of critical failures and sentinel events. So having a digital, integrated, and secure system can mitigate these issues. It'll save you time and costs related to malpractice and liability. So beyond audit trails, it supplements the information you have and makes it a heck of a lot easier to access when a transaction occurred and what happened. Communication issues are often at the core of critical failures and sentinel events. An analysis by the Joint Commission revealed that communication failures were the root cause of over 70% of sentinel events. Hospital contact centers have a role here as well, as they do so much more than answer incoming calls. Many have a direct role in patient care with responsibility for launching critical codes, issuing emergency notifications, and much, much more. In the event of a malpractice case or a dispute resolution involving telecommunications, call recording allows you to revisit the communication in question. And now, we're going to let Tom talk about the best practices for recording in healthcare.
Thank you, Mark. So when we visit organizations that are having to deal with those dangers, we've come across some very interesting things that are best practices. And today we'll be talking about documenting interactions, assessing performance, ensuring compliance, and then, of course, reporting on analytics. Next slide, please. So documenting interactions so that you have an audit trail to refer back to, with the ability to replay those interactions with a timestamp and the sequence in which they occurred, is very important for improving operational and financial outcomes. And it's very important in the fact that you can also have the proper documentation associated with that incident. There are a lot of reasons and benefits for documenting interactions that employees have with callers, whether it's a contact center agent, financial services, health practitioners, or any employee in any area of the hospital. These conversations and interactions should be recorded. So let's talk about some of the challenges and desired outcomes that comes about. Well, the first one is making sure that the challenge of recording all incoming and outgoing calls. This is important because you can establish an audit trail between the callers and employees as they move forward. The second challenge is providing supporting information to risk management when responding to sentinel events. When you record interactions, you have the ability to replay those calls with a timestamp and in the sequence it occurs, allowing you to actually retrace the scenario that went through and allow you to assess what went right, what went wrong. And also, the third challenge is assuring accountability and expediting dispute resolution to improve both operational and financial outcomes. And what happens there is that with the increased amount of communications that are happening, that are much more than just the telephone today, you have to interact, you have to be able to capture all interactions. And an interaction recording policies need to be addressing everything available, whether it's phone, email, chat, SMS, videos, photos, all that stuff is data, if you will, that can be a part of an interaction that can be documented. Next chart, please. Now, Spok has been partnering with us here at HigherGround, and we offer the Calibre call recording solution as a way to record and provide all that documentation. This enables supervisors to record calls, concurrent screen activities, monitor staff performance, produce comparative reports for individual agents, and actually allow you to allow the supervisors to introduce focused training initiatives. Our Calibre calling system has been successfully tested and approved by the Joint Interoperability Test Command, JITC, of the U.S. Department of Defense. Now, you probably don't know who that is or why that matters, but I can tell you that this proves that we have the highest levels of information assurance that is required by both the U.S. government and the U.S. military. That rigorous testing process makes sure that this level of certification means that HigherGround Calibre users can be sure that sensitive information will be protected. Now, call recording solutions go beyond just recording the conversation. You can record interactions that take place via the telephone, the radio, the chat, the mobile phone, etc. We've talked about this in the previous chart. The important thing to remember, though, is that you get more than just that information. You also can capture things like phone numbers, caller ID, or name, or any information that might be associated with that number in your CRM system. You can document who the call taker was and their department. You can also document the workstation activity. This provides metadata that allows you to get some insight if the call taker is using the correct applications to address the customer issue. It also lets you realize if they're doing it in an efficient and proper manner. Or maybe you might find out that they're focused on the task at hand, or maybe they might be engaged in personal activities such as Facebook. All of this type of information is important for understanding how your call takers are operating. And effective call recording solutions also allow you to monitor live calls for performance evaluation training purposes as it occurs. So that's real-time feedback. Next chart, please. And with all that information that you're collecting and the ability to listen in, you now have the ability to assess agent performance by monitoring the call, and you also can find out that interactions and dispute resolutions are aligned with your processes, and that agents have accountability for all of these interactions. Are they adhering to the script? Are they Are they following the procedures for dispute resolution? Are they have the accountability? Now, a quality assurance program allows measures an agent and call taker performance to ensure they're satisfied that their issues are resolved and the call has been handled correctly and the interaction was appropriate and pleasant. Now, every department in a healthcare facility may have a different nature to the context of the evaluation solution they put in place, which means there has to be some flexibility in the grading capabilities. But all departments that interact with patients and customers should have a standardized agent evaluation process in place that with routine grading can ensure that performance expectations are in place and are then routinely reviewed. Next slide, please. Now, the next best practice is to ensure compliance. And it's very important when you're looking at compliance that you protect patient data, that you track PHI data, and that you are in fact in compliance with the rules and regulations. Of course, ensuring that your organization is compliant with HIPAA and PCI DSS standards while recording is an important part of ensuring compliance. As healthcare providers, I'm sure you're very familiar with HIPAA and the many ways you need to comply to protect patient records. What you may not be aware of is that the Payment Card Industry Data Security Standard, PCI DSS, is a proprietary information security standard for organizations that handle branded credit cards from the major credit card providers such as Visa, MasterCard, Amex, and Discover. Now, contact centers today of any kind that handle credit card transactions are bound by these PCI standards. This is not an exception in the healthcare environment where you often are having to take this type of credit card information. The PCI standard is mandated by the card brands and administered by the Card Payment Industry Security Standards Council. The standard was created to increase controls around cardholder data to reduce credit card fraud. Validation of compliance is performed annually either by a qualified security assessor or you can do a self-assessment questionnaire for companies that handle smaller volumes. Typically in the recording world, what you do is when the customer starts to provide their credit card information, you either redact it with silence or with a tone so that information is not captured in the recording so that it does in fact meet the PCI DSS compliancy standards. So move on to the next chart, please. The next best practice is reporting of analytics. Reporting of analytics at a healthcare contact center can provide the intelligence needed to establish performance benchmarks and then the overall key performance indicators for agents. It looks at how you can improve first call resolution time and ultimately improve the caller's experience they have within your organizations. Whether you're establishing those KPIs or improving FCR or improving experience, you're going to be working with trends and trends analysis. So in that respect, KPI monitoring is more than just spreadsheets and charts. It's about establishing the baseline and looking where the performance goes over time and obviously continually striving to improve those baseline measures. As you know, FCR is a great measure of customer satisfaction. It identifies gaps in the service staff training. It applies for improving overall quality of contact center, and it allows you to actually identify top performing agents. Now, there are some other things that go on in this world with analytics. You can determine performance averages, so you can determine if everybody is meeting the needs that you need. Then there's also the idea that you can use those results in a gamification environment so that you can drive competition amongst performers. And you have to remember that top performing contact centers are always trying to improve. They will leverage any amount of data they can get to monitor trends and adjust accordingly, which goes back to this idea that if you record everything, you get metadata on everything, and that actually allows you then to actually put together that type of trending information. And it also allows you to implement real-time dashboards and notifications to monitor the changes in the contact center. Next chart, please. Now, from the Calibre point of view, this is a standard dashboard that can be configured to run on a director or supervisor or even an agent's workstation. Many forward-thinking contact centers actually display these performance metrics on monitors around the contact center. Again, going back to this idea of gamification, allowing them to see the activity and the pulse of the contact center at any given time. Real-time feedback on what's actually happening. Now, the measurements like you see in the middle of the chart, in the upper part there, it is not just the performance on the number of calls the agent has taken, but also the performance across media types, including voicemail and email and chat. It's important to remember that a contact center agent today will be taking emails, they will be doing chat, they will be taking phone calls all at the same time. And that really allows you to see how that person is operating correctly. Next. And that's the last of the best practices. And I will return it over to Mark to give you a little brief on call accounting.
Thanks, Tom. I wanted to touch briefly on another service you may want to include as a part of your call center strategy, and that's call accounting. Call accounting enables you to track inbound and outbound calls. And with this, your business will have better control over telephone call expenses. A call accounting system can identify call type, the origin of the call, and the duration of the call. From this real-time data collection, you can see where you can save on business and operational costs. Without having a call accounting software in place, you could experience overcharges on calls. Some examples of that are international calls as well as personal calls. The main benefits that you're going to get from a call accounting solution in place is better work productivity, lower telecommunication costs, and again, improved customer satisfaction through quality support. So I just wanted to touch briefly on the features and the benefits of a call accounting system. Those of you may or may not be familiar with this, but I'll share this with you. So what's really nice about it is you can have automatic report scheduling and integrated email distribution. So the information that you need to get can be scheduled and it can be sent out, and open your email, there it is. There's also powerful filtering and sorting capabilities, so you can really dig through those call types and understand their origins. And beyond that, there's also, you have the ability to track third-party billing, and you also have up-to-the-minute monitoring. And then you also have the added capability of doing remote site polling, and you can do that via the internet. And there's also a lot of reporting with this. There is a built-in toll fraud alarms, and there's also tenant and account code billing capabilities, and then import scheduling. Benefits include the solution is scalable, it can meet your changing needs, it's easy to use. You can also monitor activity enterprise-wide, so this doesn't have to be specific to the call center. You can go beyond that and look at the entire organization. And then, of course, it has concurrent system administration. So I just wanted to share that with you as well. It's something to think about for your call center strategy. At this point in time, we've reached the end of our presentation today, and we wanted to open it up to questions. So I'm going to ask Abby what questions we have out there and actually how to submit a question as well.
Yeah, great. Thank you both so much for that insightful presentation. Like Mark said, we'll now take some time to answer your questions, and it looks like we've had a few submitted already. But as a reminder, if you have a question, please submit it in the questions box, and we'll answer as many as time allows. Okay, so our first question is, can you run detailed reports of all recorded interactions? And we'll give this one to you, Tom.
Yes, you can. How you filter the data that you collect out all these interactions can allow you to then filter through how you actually present the reports, whether it's provided to on a per agent basis or a per department basis. You can also then figure out over time if the performance is improved or degraded. These are all capable within the system, and the reporting capability actually has the flexibility to do customized ad hoc reports or standardized reports that can be done at appropriate times based on your needs and or the compliance requirements.
Great, thank you. Another attendee has asked, can you record more than one computer monitor for workstations with multiple monitors? If you want to take that one.
I'll take that one. Yeah, actually, the way our system approaches is that any workstation that actually has our recording client or screen capture client on it will capture all of the screens, and that's very important because there are very few agents within a contact center today that use a single screen. There's so much information that they have to pull together and use that they'll have multiple screens, and you have to make sure that when they're actually responding to a request that they are actually going to the right resources, which means you have to capture all the screens that they use, and we do in fact do that with our screen capture capability.
Great. Another question, what types of calls need to be recorded in hospital call centers?
The short answer would be all of them, and the longer answer says, and there's for three particular reasons: to ensure compliance, to prove compliance, and to monitor trends. Regardless of if it's a long call or a short call, or regardless of the media that the call type comes in, if it's an email or chat, a text, whatever, all of that information along with the metadata that comes with it is very important for understanding if everyone is doing everything according to the procedures, therefore you're ensuring compliance, and that if you have to go prove that everyone did everything properly, you have everything recorded, there is no misses, so that allows you to prove compliance. And with all that metadata that you collect, then you can absolutely trend what's going on and determine if you're improving or not improving, and allow you to actually be proactive in many cases to make sure that a performance is improved prior to it becoming an issue.
Great, thank you. And we have time for one last question. What can you record within a hospital other than a phone call? And we'll give this last one to you, Tom, as well.
Pretty much anything that you can collect data on, our system can capture. So if it's an email or a video feed or a photograph, we can capture that. It could be a phone call, it could be a text, it could be chat. Anything that produces some amount of data, we can capture. And I think the importance to remember is that capturing everything allows you to ensure compliance, prove compliance, and be able to monitor and act on trends.
Thank you. And unfortunately, we're out of time, so this concludes today's webinar. If we were unable to get to your question today, we will be sure to follow up with you. If you'd like to chat with a Spok representative on the topics that we discussed today, you can do so using the link in your chat box. You can also continue the conversation with fellow attendees by using the hashtag SpokWebinar on Twitter. Follow us on Twitter, LinkedIn, and Facebook to get all of the latest news from Spok, as well as industry news and trends. Thank you all so much for joining us. We hope that you enjoyed this webinar. Have a great rest of your day.